Hey guys, it's Maggie and I am back today. We are gonna do a sit and talk rather than a walk and talk because it was really super windy outside. I did attempt to do a walk and talk for Wednesday, but yeah, too windy. My camera was just not having it, and also it is freaking hot again. So we will be inside with a fan. I have a fan right down here, a fan blowing on me. So if you hear that noise, just deal with it, okay? Just deal with it. Anyways, I am going to give you a little Monarch update. Unfortunately, I just shared on Instagram that I had two that I thought were going to go into a chrysalis, and yeah, unfortunate update, so I'll give you that. I'm going to share the little walk that I did do. No sound, just so you can see some of the flowers I have blooming, and then we'll get into the walk and talk or sit and talk topic of this week. Alright, I will start off with the negatives first, and then I'll show you my pretty flowers that are blooming this week. So for the monarchs, I had two that I thought, I was sure they were about to go into a chrysalis. They were hanging from the top of my little box, and then they were in the little J formation. So I'm thinking, any minute now, there's gonna be some action. And then they died. And I had no idea why. They kind of straightened out. And I kept looking at them and I was like, they don't look vibrant anymore. They don't look healthy. And by the next morning, they had little silk strings coming down the sides of them. And I was like, that's weird. And they were gone. Apparently there is a fly that lays their eggs. They fly and inject the caterpillar with their eggs. And then as the caterpillar grows, I guess the eggs grow and hatch inside of them. I don't really know. And then when the caterpillar is about to go into a chrysalis and hangs from the top, the larvae pop out, and that's what happened. So both of them were infected with it. I still have a bunch of monarchs though that they might be infected, they might not be, I have no idea. So I'm keeping them in the little box. I'm letting them eat all of the milkweed that they want, and if they don't make it, hopefully their short little lives were good. Makes me sad. But if they do, then I will update you with that. And then what I did, I thought, okay, maybe if I find monarch eggs, or I find really tiny little caterpillars, they won't have been big enough, I guess, for the fly to inject the eggs into it. I don't know if that is true or not. So I found 4 very tiny monarch caterpillars, and I made a separate box for them. Apparently, they're not going to give it to each other. They're fine. Even if they were in the same box, it would be fine. But I decided, let me just separate it, just in case there's anything else going on, and we'll see what happens. But I have 3 right now that look like they're big enough to go into the chrysalis form, and I don't know what's gonna happen to them. So that's the sad update this week. On the positive side though, like I said, I did go around the yard. I did try to do a walk. It was very breezy out and not really that pleasant, and so hot. I can't even, nah. I was getting dehydrated, so I had to come in, got my Zach cup, the cup that I always find funny because the brand is how Zach spells his name, so it's my favorite cup. As for the other flowers, my sunflowers are doing amazing. I have so many sunflowers right now. The goldenrod that I've been saying is all over our property. We are just starting to get the first few, which is always my sign of fall is on its way. Fall is coming. Pretty soon, I think that we have a small section of aster. It's like this, kind of looks like a daisy, but it's purple, really pretty. I have a little patch of that I'm waiting to see. That's when fall is really going. I actually picked some of that and goldenrod and added it to our wedding flowers because I wanted a lot of kind of wild flowers. I wanted that kind of look, but I also did sunflowers and dahlias and stuff. Yarrow was kind of at the end of its life. I did see a big patch of that. And like a few other flowers, you know, just some random wildflowers that I thought were pretty. They're probably invasive, but they're gorgeous, so we're gonna include them in my little walk around. One thing that I did see was the blackberries that I've talked about, and some of you guys have said like, hey, blackberries are edible. So I had somebody tell me, I forget who told me this, but that the seeds apparently had some kind of poison in them, and if you chewed on the seeds, you could get sick from blackberry, like wild blackberries. Although, looking at the blackberries that I saw today that are actually like closer to our house, I am almost wondering if they were planted on purpose and they are actually like fine to eat. They're really big, and usually like wild blackberries are smaller, and you know, the ones that you buy at the store that you can eat perfectly fine are cultivated, and they're usually a bit bigger. So I am almost wondering if we do have a blackberry bush that is edible, but we do have a lot around the yard that just is smaller, and I just figured, you know what, we have so many other berries. We have the wine berries, we have black raspberries that haven't killed me yet, so maybe, you know, it doesn't matter if I don't eat these. So I don't know. I have no idea. And then I saw this crazy bug that I have never seen before, and it was holding the remnants of a bumblebee, which made me a little bit sad. I was trying to get the little cabbage butterflies that were flying around, and then I noticed this bug and kind of freaked out a little bit, but it was huge. I have no idea what it is, but it was like holding on to the bumblebee. I don't know, maybe you guys can tell me what it is. But anyway, that was the walk that I did today. Hopefully next week it's a little bit cooler, a little less breezy. I'll try and switch out my mic. The only problem is the mic that I can use in the wind does not allow me to see myself. Like, I can't flip up the screen and then have the mic in front of it, because then I can't see the screen, just to make sure that I'm in focus or like even in the frame. But you know, you can kind of aim, so maybe it'll be fine. Anyways, holy cow, I've been talking for 11 minutes, so sorry, taking a little bit of time to get into this video, but I don't know about you guys. I have a couple of YouTube people that they just vlog and they just talk about they're not even vlogging, they're just talking about their day, and I will watch them while I'm doing the dishes or like, you know, random things around the house, because A, it's relaxing to me, B, I feel like I know them and I'm listening to a friend talk to me about their day. So I don't know, maybe maybe the blabbering videos of me, my walk and talk Wednesdays where I'm sitting and talking, maybe that can act like that for some of you guys if, you know, you just kind of like want background noise. I do that all the time with YouTube. Anyways, so last night, Zach and I were sitting there and I was like, man, I need a topic for Walk and Talk Wednesday, which, by the way, guys, if you want to give some topics, like, you know, interesting topics with chronic illness, healthcare, anything like that, please put them in the comments, and, you know, we can talk about it on an upcoming Walk and Talk Wednesday or Sit and Talk Wednesday, depending on the heat and wind. I was like, I need a topic, and then somehow I got on the subject of, you know, times when maybe I was not the best patient, and Zach was like, what? I was like, yeah, like there was a couple of instances when I was younger, and even more recently, where I probably was labeled a difficult patient. And honestly, we could do a whole talk on the relationship between patients and their caregivers. I mean, like health caregivers in the hospital, mainly nurses, but you know, doctors, nurse techs, things of that nature. But I thought that some of these like experiences that I had, I don't know, like might be interesting just to see the perspective of both when I was the patient, and then, you know, at one point I was not a nurse when I was a patient, and then I became a nurse, and was then a patient in the hospital, and just like kind of how that differed. So one of the instances, oh my gosh, I feel really bad about, and I think I mentioned this recently when I was talking about the anxiety that I had been having and the medications that I'm on for that. I was talking about panic attacks, and I still don't know for sure if I had had panic attacks when I was younger, but I do know that early on when I was first starting to get hospitalized for my Crohn's disease, and even at home, I do remember a couple of times where I had trouble breathing, and the only way I can describe it is it's like somebody took all the oxygen out of the room. I could breathe in, but my lungs were not getting the oxygen out of the air. That's what it felt like, and it was terrifying when it happened, because it usually happened with no warning at all. Like, it would wake me up out of the middle of the night, and it would happen. And I know some of you guys said, like, could it have been asthma? So I don't talk about it a ton. I actually did, well, I do have asthma. I remember in nursing school, I had this one pediatric professor who said, he would make fun of people that said they grew out of asthma because it's a chronic condition and you don't grow out of asthma. And I'm sitting there like, well, I had pretty severe asthma when I was a child. It has been about 20 years since I have had any asthma symptoms, and I am very fortunate for that. I completely understand. But I at least went to the ER one time for an asthma attack. I had the big old nebulizer. I was on inhalers. Like, I did the whole 9 yards. A lot of fun. I had very bad asthma, and then as soon as I got Crohn's disease and started getting treated for Crohn's, the asthma just gone. Totally gone. So anyway, I was sitting there in my nursing class like, well, I don't know what you would call it. I always said I grew out of it, but it's been 20 years. No symptoms. I don't see a doctor for it. I have not had an asthma attack in 20 years. So I have asthma, but have not had symptoms in a very long time. Anyways, all that to say that it was not an asthma attack, because I was very familiar. Like, I still remember what an asthma attack feels like, and it is terrifying, but I had triggers that were very, cats was the worst one. I was so bad with cats when I was younger. Thankfully, that has gone away. Used to be with dogs, too. I used to be extremely allergic to dogs, and I don't know if it's because I just, like, forced myself to have 4 of them. I have no issues now with them. But I know what an asthma attack feels like. That was not it. Especially not in the hospital, where it's not a sterile environment, of course, but it's... my triggers that I had were not there, and my triggers were smoking. I grew up in the 90s when smoking was still very, very popular. The smoking section in restaurants, if there was a smoking section, sometimes it was just, a free-for-all. And so we had to be really careful about that, where I could go out to eat with my family based on the smoking situation in the restaurant. So yeah, it definitely was not an asthma attack, but that is something that happened to me. Anyways, 17, almost 18 minutes into this video, getting to the first instance here. I had one of those in the hospital, and something about me as a child was very sensitive about everything, and anytime somebody would ask me like, oh, are you okay, Maggie? Like, what's the matter? That would make everything 100 times worse for me. I would rather you ignore me. If I'm crying, ignore me. If I'm going through one of my episodes, panic attacks, whatever the heck they were, please ignore me. Do not ask me if I'm okay. But obviously the nurse has to make sure that her patient's okay, especially if they're saying they're having trouble breathing. She was probably afraid I was like throwing a clot or something, but I wasn't. It was just like overwhelming emotion and inability to breathe. And then her asking me if I was okay was not helping, and it was making it so much worse. It made me feel like I had to cry, and I was like, oh. Hopefully you liked my acting there. And so my dad was like, you have to stop. And the nurse would not stop. And she was, she wanted to, start doing vitals and stuff. And I was losing it. I was like, couldn't breathe. And so my dad had to yell at her to get out of the room. And I can only imagine how upset she was. I hope that we did not affect her too much. It was truly one of those situations where, like, patient knows best. I knew, my dad knew what was gonna help the situation and what wasn't, but as the nurse, you're like, my patient can't breathe. I'm not leaving them. So, I still feel bad about that one. There was another time where, obviously, I wound up working on this floor at this same hospital. So I got to experience it as a nurse, and I understand the short-staffedness and the high patient amount and acuity. It was rough. It was rough. But I had one morning change of shift. The nurses, as they were doing bedside report, woke me up. I had been on IV fluids all night, and since they woke me up, I realized I need to go to the bathroom. I need to go right now. So we wound up telling the nurses, and they were, in the midst of their reports, so they said, oh, okay, we'll be right back and we'll help you out. Well, they didn't come right back. And if I had known that I could have just unplugged my IV pole and gone to the bathroom, like, clearly that's what I would do now. Like, I know how to work an IV machine. I'll just, even if it turns off, I'll just, I'll take care of it. Not supposed to, but I will. Because I don't want to bug the nurse. I know that they're busy. But in this instance, I didn't know what I didn't know. And I thought that the thing was going to turn off and I would screw it all up. And so we wound up having to, like, the nurse came in and my dad was like, where the heck were you? Like, she's got to go to the bathroom. You said you were coming back and he didn't. So I don't think that made the best impression on that nurse. But it's like, I told you what I needed and you walked away, and I told you this was not, I got an hour before I'm gonna pee the bed. No, I told you it was an emergency. So, I don't know. I think that there is just this divide between patient and nurse communication, and it's like getting wider and wider, where patients are frustrated, understandably so. They're in pain, they're sick, they're in an unfamiliar environment, and they can't just meet their needs like they can at home. They have to, ask a nurse. But on the other side of it, I understand the nurses are busy. The whole hospital is busy. Everything is backed up. And sometimes it's like, if the nurse, could the nurse have said, hey, unplug your IV pole and, you can head on into the bathroom. Small amount of communication could have made the rest of the day a bit better. But obviously the relationship was strained a little bit. And you know what? I have dealt with a lot of difficult patients myself. I've been yelled at by patients, called names, been fired by patients, and I really just try to step back and look at the situation like I was fired by this one family because it made me sad. The patient needed frequent blood sugars, and this patient, I think, would have been fine, but every time that I would go in, or any nurse would go in to take the blood sugar, the parent would, oh my gosh, it's okay, this is gonna be so quick, and it'll only pinch for a second. So the reaction that the patient had was, I think, more than it would have otherwise been if we had just come in there quietly, treated it like it was not a huge deal. So anyways, I usually worked night shift, and every time that I went to take this child's blood sugar, they would freak out. And there are different size lancets that, gauges, and the parent was refusing the one that was adequate for this child. So the one I was using was not working effectively at all. I might have to prick this child multiple times in order to get blood for blood sugar, and because this patient has low blood sugars, I'm not gonna not do it. So anyways, the parent got really mad at me and fired me. And I don't know if it was, I understand that difficult environment to be in. They're dealing with people that they don't want to deal with. And maybe on my part it was I didn't communicate that. Like, hey, if we used a bigger lancet, maybe this could be an easier process. Yes, it might hurt a little bit more, but I won't have to do it multiple times. And, maybe we could lower our reaction to the blood sugar process so the patient doesn't think that there should be a negative response to this. Because often what happens with kids, you do so many blood sugars on them, they get used to it. And it is sad, but as a chronic illness patient myself, it's like, yeah, IVs suck, but get me, go ahead, do it, it's fine. I'm used to it. It's it comes with the territory. I don't know. So, I don't want to label a patient as difficult. I think that's such a negative connotation for the situation that they're in. And I know that I have been labeled difficult myself. But I try to be understanding in all situations now, whether I am the patient or I am the nurse. I understand that patients are put in a lot of uncomfortable, painful positions that they just didn't sign up for in life. I get that because been there, done that. And I understand that nurses, they are stretched thin. Oh my gosh. They work extremely hard. I'm not speaking as a current nurse. Like, I am not working bedside. But I was bedside before the last 2.5 years or so. I left right before, and it was tough then. So it has only gotten worse. Anyways, so those are kind of my thoughts on that. If you're a patient, give your nurse grace, communicate, or give, any healthcare professional that's helping you, give them as much grace as possible and patience, but also communicate your needs very clearly, very firmly. Advocate for yourself. I've certainly had to do that. And I'll tell you this story. And I don't know if I've told this story or maybe I've given a little bit of it. I had a situation more recently within the last couple of years. It was when I went septic with my kidney. And I had a nurse that, I wasn't told during this nurse's shift what was going on with her shift. So there were things that I was unaware of, that she was charge nurse and she had a lot of traumas come in, because I was on a trauma floor. That's the only floor that they had room on, which clearly I was septic, so I was just getting IV medications. I was probably considered, one of the easier patients on the floor that night, and even so, I was on multiple IV antibiotics, which with somebody who is septic, you have to give them as close to on time as possible. And I know that from being a nurse myself. And, I would have gotten in trouble if I hadn't given IV medications on time. We had very specific windows, time windows of when we could give a medication. And if we didn't give it within that time, we had to have a really good explanation or there would be a problem. And I had that happen. The nurse was running around busy. I didn't know that. I called out multiple times for Tylenol, and because I was febrile at the time and I didn't receive the Tylenol. from any of the nurses that came into my room, not even just my nurse, but I had other nurses come into my room, check my temperature, and be like, oh yeah, I'll go tell your nurse that you need Tylenol. And it's like, well, if you're not busy and it's an oral medication of Tylenol, hi, you can get it for me. Like, that's what I would have done. You know, if I had another nurse on my floor that was experiencing that. But yeah, I knew that I was due for my IV antibiotic around 2 a.m. and I'm a fairly light sleeper in the hospital, plus I had a fever and I was uncomfortable, so I figured I'll probably wake up when she goes to flush my IV. I'll feel that, and I'll know that it was given to me. I woke up at 5 a.m. and realized that I wasn't woken up in the middle of the night, so I'm thinking, did I sleep through it, or did I just not get it? And at this time, I was having a fever, called out to the nurse a couple times. She didn't come into the room until 7:30 a.m., right before she handed me off to the day shift nurse. She hung my IV antibiotics. I knew in my mind, I knew the schedule. I think it was either every 6 to 8 hours I was receiving this one. So I knew that it wasn't the right time already. And I was like, did I not get the 2 a.m. dose? And she also gave me the wrong dose of Tylenol. I asked about the IV antibiotic timing, and he looked back on the chart and said, it looks like she just didn't give it to you at 2 and then gave it to you at 7:30 instead. And I was like, yeah, because it's still running. So at that point, with those types of, you know, issues, I know what it's like to be that busy nurse, but they didn't tell me that during the shift. The day shift nurse told me, oh yeah, she was really busy, she was charged, and she had a full set of patients and a lot of traumas. I try to be absolutely as understanding as possible, but that is a safety concern. You know, with septic shock, you need the antibiotics on time to make sure you're getting rid of that infection, because that infection can kill you. And it was the first time that I ever was, I don't report anybody, like nothing. I don't do that because I don't know. I know that difficult things come up, and situations are not perfect. But I wound up submitting a report, and I was just like, hey, this wasn't right. Like, this should be taken care of. Even if that nurse, like, I get that she was busy, I wanted the unit to know. I wanted the manager to know. Like, if you were that short-staffed, that needs to be addressed. Somebody needs to look into that. So I wound up having a phone conversation with the manager of the unit, and I just explained what had happened, and she saw it in the nurse's documentation, so that, you know, I said, I understand that she was so busy, and like, I totally get it. I'm also a nurse, so I've been there, but I would have gotten fired for that. Like, so, you know, I just want to make sure that for future patients, there's safety for them, because that is scary. I was septic, and that was like right after I got admitted, so that wasn't towards the end of my admission. Anyways, it's been a balancing act of being patient, kind, respectful, and learning to advocate for myself. And that was one of the few moments where I had full confidence of like, no, I need to say something. I'm gonna say something. That was not right. That nurse probably did not like me, and I feel bad about that. But I had so many wonderful nurses at that hospital, that, you know, it's not a hospital thing, and it's probably not that nurse. It is not that nurse's fault that she was put in that position. But, you know, there needs to be a better ratio for nursing to patients. We could go on a whole thing on that, but we're not gonna today. Yeah, so I just thought I would share that, you know. I try to be as chill a patient as possible, and just, you know, I want any of the hospital staff that comes into my room, I want them to just be relaxed. And a relaxed nurse is a nurse can do their job, no problem. They're not gonna feel like nervous, because I've had the worst is when you walk into a patient room and the patient goes, well, yes, I am a physician of something or other, and I'm super high up in my hospital, and I know everything you're doing. And you're like, oh my gosh, I cannot make one wrong move. I have to do everything perfectly. And then you're like shaking as you do stuff because you're so worried. I want people to feel relaxed around me and enjoy coming into my room so that they want to care for me. So yeah, it's just, I really felt the need to advocate for myself. Like I said, that hospital was wonderful. I had so many great nurses. I barely remember, but I remember the nurse right after my proctocolectomy that received me from the OR, or from the post-anesthesia unit. I remember she said, okay, I'm gonna do a skin check on you. And she rolled me over and looked at my bottom where my incision was, and I obviously was nervous about the way it would look, and she goes, girl, you look so good. This thing looks amazing. Oh my gosh, you have such a nice butt. And it it made just the experience so much better. Like, I loved that nurse. So I hope she is doing well. But anyways, I hope that you guys enjoyed this video. Please share below, as the sun is like setting on me and the lighting is getting a little funky. I hope that you guys are feeling great, and I will see you in the next. Bye guys.